Do you feel pain in your legs at the end of the day? Are your feet always swollen or tingling? Or maybe you felt pressure in your chest and ignored it. Be careful. These could be signs that your veins are clogged and your life could be at risk. In Brazil, more than 400,000 people die every year from cardiovascular diseases. Many of these deaths could be avoided with something simple: paying attention to your body's signals. The problem is that most people don't recognize the silent warnings that appear in their legs, feet, and heart. In this video, you'll discover the most dangerous symptoms that you may be ignoring, and that indicate that your veins may be clogged. We'll talk about pain, swelling, tingling, wounds, shortness of breath. All of these may seem small, but they are your body's cries for help. So stay with me until the end, because you'll learn how to identify the signs and, most importantly, know when to act to avoid a heart attack, stroke, or even amputation. Take advantage and subscribe to the channel. Like and share this video with someone you love. This could save lives. Most people only worry about their heart when they feel chest pain. But the truth is that the clogging of blood vessels can start silently, slowly, and dangerously. This problem is called vascular obstruction, and it happens when the veins or arteries, which should carry blood freely, begin to narrow due to fatty plaques, clots, or inflammation. It's like putting a stone in the middle of a pipe. Little by little, the blood flow decreases, until it stops. Now imagine this happening in your legs, or your feet, or worse, in your heart or brain. That's when tragedies happen: heart attacks, strokes, thrombosis, amputations. And the scariest thing? Many people are living with these obstructions right now, without knowing it. Poor circulation can start with something simple: a feeling of heaviness in your legs, a cramp that appears every night, or a tingling in your big toe. Sounds harmless, it's not. A study by the Brazilian Society of Angiology and Vascular Surgery showed that more than 38% of Brazilians over the age of 40 already show signs of poor circulation, but only 1 in 10 seek medical help. You can't be one of these statistics. Your body speaks. And that's exactly what we're going to talk about now: the signs your legs are trying to show you. Have you ever felt a strange heaviness in your legs, even after sitting all day? Or noticed that your ankles are swollen in the late afternoon, even without physical exertion? These are classic signs that your circulation may be compromised. When the veins start to clog, blood has difficulty returning to the heart. It stalls in the extremities, especially the legs. And that's when the symptoms begin. Persistent swelling in the feet or ankles, dull pain, or a feeling of heaviness in the calves, frequent. Night cramps, dark or purple skin around the ankles, and visible, tortuous veins. The famous varicose veins are not merely aesthetic. They are signs of weakened, compromised veins. These symptoms often appear gradually. At first, the person thinks it is normal due to the fatigue of the day, but the body is crying out for help. If you ignore it, the problem will only get worse. In more severe cases, these veins can rupture or form clots, and this can lead to deep vein thrombosis, an extremely dangerous condition that can cause pulmonary embolism and even lead to death. Don't ignore your symptoms. The sooner you identify the signs, the greater the chances of reversing the condition and avoiding serious complications. The feet, because they are far from the heart and brain, are often the first to show that something is wrong with the circulation. They are the most affected when blood cannot reach them with sufficient force or return properly. And do you know what is most frightening? Many people ignore the signs in their feet, thinking they are nonsense or just bad posture. But these little clues can be the first warning signs of a serious condition. Constant tingling or numbness, wounds that take a long time to heal, constantly cold feet, changes in skin color and hair loss or brittle nails are all signs that something is wrong. When the vessels are clogged, the tissues receive less nutrients. The result? Weakened nails, dry skin, and lack of hair on the lower legs or toes. Many people only realize the problem when it is too late, when the wound becomes infected, or when simple numbness evolves into necrosis. In extreme cases, this can lead to amputation. You don't have to get to that point. Taking care of your feet is an act of self-love. They carry your body every day, and they may be screaming for help. And it doesn't stop there. Now that you understand the signs in your lower limbs, it's time to move on to the most vital organ of all: the heart. When the veins or arteries that feed the heart begin to close, the danger is real and imminent. Unfortunately, Many people only discover the problem during a heart attack. But the body warns you beforehand, and you need to learn to listen. Coronary artery disease occurs when the arteries of the heart become obstructed by fatty plaques. This process is slow, silent, but lethal. And it doesn't just affect the elderly. More and more people between the ages of 30 and 50 have been suffering from fulminant heart attacks. The warning signs include excessive fatigue for no apparent reason, pain or a feeling of tightness in the chest, shortness of breath even at rest, irregular or accelerated heartbeat, cold sweat, and dizziness, especially when accompanied by chest pain or nausea. These are typical symptoms of a pre-heart attack and require immediate assistance. Be careful. Women may present different symptoms. Instead of the typical chest pain, many report extreme fatigue, nausea, neck or back pain. Unfortunately, this is why women's cases are often underdiagnosed, with fatal consequences. The truth is that the heart rarely stops without warning. But you need to be alert and, above all, not normalize unusual symptoms. Many people die because they think it's just fatigue, or it must be anxiety. If you have experienced any of these symptoms, seek medical attention immediately. Every minute counts. In the case of a heart attack, every 5 minutes of delay increases the risk of death by 7%. Now that you know how to identify the signs in your heart, let's finish with the most important thing: how to protect yourself, and when to seek help to avoid irreversible consequences. Knowing how to identify the signs is essential. But the real power lies in prevention. And the good news is, you can prevent your veins from clogging and protect your cardiovascular health with simple and effective measures. Adopt an anti-inflammatory diet. Avoid ultra-processed foods, excess salt, and trans fats. Invest in fruits, vegetables, nuts, and fish, rich in omega-3, such as salmon and sardines. These foods clean and protect your arteries. Get moving every day. Walking 30 minutes a day improves circulation, strengthens the heart, and reduces the risk of blockages. If you can, include resistance exercises and stretching. Control silent factors. High blood pressure, diabetes, and high cholesterol are the biggest villains of vascular health. Get regular checkups and follow your medical treatment correctly. Quit smoking right now. Smoking damages the walls of blood vessels and accelerates the formation of fatty plaques. Quitting smoking is one of the most powerful actions to save your veins and your life. Pay attention to the signs and don't hesitate to seek help. If you notice any of the symptoms mentioned in this video, swelling, pain, tingling, shortness of breath, chest pain, see a general practitioner or angiologist immediately. If the symptom is acute, go straight to the emergency room. And remember, don't wait for the pain to get worse or for symptoms to build up. When it comes to vascular health, acting quickly can make the difference between life and death. Now you know. Leg pain isn't just about fatigue. Tingling in your feet isn't just about posture. Shortness of breath and extreme fatigue aren't just about stress. They're warning signs. Signs that your veins may be clogged and that you need to take action. Here we talk about symptoms in your legs, feet, and heart. Subtle signs that, if ignored, can lead to something tragic. Heart attacks, strokes, thrombosis, and even amputations. And worst of all, many of these situations could be avoided with a simple medical visit and changes in your daily routine. So make a pact with yourself today. Observe your body. Take care of your diet. Walk, breathe, get tests. Your health is the greatest gift you can give to those you love. And if you've made it this far, share this video with someone in your family. Maybe that person who lives with leg pain, or that friend who feels tired all the time. This video could save a life. If you liked it, leave a like, subscribe to the channel, and comment below. Have you ever felt any of the symptoms we talked about here? What do you do to take care of your vascular health? Your experience can help other people. See you in the next video. And remember, those who take care of their health, take care of their life, or those who take care of their life, protect the future.